Hello and welcome to another episode of your show, Medical Talk from the Desmond Diabetes Institute. I'm Dr. Mohammed Al-Muhtab. A new episode highlighting the great efforts of the Desmond Diabetes Institute and all the dedicated departments and the exceptional team of experts who are committed to advancing diabetes treatment and prevention. In this episode, we will be talking about a very important department within the Desmond Diabetes Institute, which is the Clinical Skills Center. We will be joined by Dr. Ibtisam Al-Badr, head of the Clinical Skills Center at the Desmond Diabetes Institute, to highlight as much as we can about this center and its important role right after this break.
The Desmond Diabetes Institute, DDI, was established under the patronage of His Highness Sheikh Jabir Ahmed Al-Sabah, the late Emir of the State of Kuwait, and the Kuwait Foundation for the Advancement of Science, KFAS, to combat the prevalence of diabetes in Kuwait. DDI's mission to address the diabetes epidemic in Kuwait through focused diabetes research, integrated prevention, training, and education. DDI's vision: to be the leading diabetes institute in the Middle East and North Africa region and to be recognized internationally. DDI has established unique, innovative technological, educational, and clinical platforms to discover mechanisms that cause diabetes. Ultimately, we want to aid in understanding the diabetes epidemic worldwide. We emphasize the importance of diabetes education through our lifestyle, nutrition, and the Clinical Skills Center, backed up with advancement in clinical research. This is a unique institute where we have the multidisciplinary team integrated within the clinic care research, starting from diabetes education, nutrition, physical activity, pharmacotherapy, podiatry, the imaging center, with all specialties including ophthalmology, nephrology, cardiology, cardiometabolic, and periodontology. The translational research goes from the bench to the bedside and back to the bench.
Medical training is incredibly important for medical students, healthcare professionals, and even the general public because it equips them with the skills and knowledge needed to handle healthcare challenges effectively. For medical students, thorough training is the foundation of their careers. Practical and hands-on training is crucial for delivering high-quality patient care and improving healthcare standards. Current healthcare professionals need continuous training to keep up with the latest advancement in medical science and technology and stay updated with new treatments and protocols. Additionally, training the general public in basic health skills like first aid and CPR empowers everyone to act effectively in emergencies. Such knowledge can save lives, reduce the pressure on healthcare systems, and create a more health-aware community. The availability of training centers is important in making this education accessible and effective. These centers provide the necessary resources, equipment, and environment for high-quality training. We are glad today at Desmond Diabetes Institute is among one of the dedicated places that provides such training courses. And to know more about this center, we are happy to have with us Dr. Ibtisam Al-Badr, head of the Clinical Skills Center. Dr. Ibtisam, welcome to Medical Talk.
Thank you, Dr. Muhammad. Great to be here with you today.
Thank you very much. We have so much to talk about, but if you can just give us first a brief about the training centers you have here at Desmond Diabetes.
Sure. The Clinical Skills Center is part of the medical division of the Desmond Diabetes Institute. It aims to educate and train students, healthcare workers, be it medical doctors or nurses, and as well and more importantly, the public themselves. We are accredited by the AHA as a center of training in Kuwait, as an international center, as well as all our courses are registered at KIMS. As an example, last year we carried out around 1,654 courses, and we had around, 1,654 students, and we provided 372 courses in 2023.
And what would you say the primary mission for your center?
Our primary mission is to disseminate education and training to both the public as well as healthcare providers in Kuwait, be it nurses or medical doctors.
Could you explain to us the type of training simulations that you have here and equipment that are available at the center?
Sure. We have, it depends on the courses we provide. We provide a multitude of courses. The AHA courses, which is the American Heart Association courses. We provide the ATLS course, which is the trauma course by the American College of Surgeons as well. And the basic surgical course, which is the surgical course training by the Royal College of England.
The Royal College of Surgeons, basically.
The Royal College of Surgeons of England, as well as the simulation courses in terms of the basics of patient care, nasogastric tube insertion, polycatheter insertion, IV access, taking blood from patients. All these courses are available at Desmond.
So when we say simulation for the viewers, just to be clear, that basically they have like a mannequin?
We actually have a mannequin that you can use for these procedures. This way you are able to practice, find out what it is that you've done well and improve on that, and find out what it is that you can repeat again in order to get the optimal result.
And these courses are accredited, right?
They are all accredited. The AHA courses are accredited by the American Heart Association, and we're actually, the Skills Lab is accredited by them as well, We go through the accreditation cycle every 2 years. Our ATLS is the certificate comes from the American College of Surgeons. They get a provider certificate as well as the AHA. And the Royal College of England actually gives us the certificate that our candidates have completed their certification. And all these courses are also registered with KIMS, as we said earlier, and we get CMA points on them.
The
Everything
Kuwait
we
Institute
do
for Medical.
is accredited by KIMS.
So all these courses are accredited.
All our courses are accredited. As an example, the AHA courses, which is the American Heart Association courses, are accredited by the AHA, and the center itself is accredited by the AHA. Our ATLS course, we get the provider card from the American College of Surgeons. As for the BSS course, we get the certification from the Royal College of Surgeons of England. And all our courses are accredited by the Kuwait Institute for Medical Specialization in Kuwait.
So all doctors locally, I mean, from the private sector and the government, they can actually...
Are able to apply and work, as well as our nursing staff and our medical students. There are certain courses for them, especially the simulation courses as well.
That's wonderful. We got more questions for you, but we have to take a short break. We'll be right back. Stay with us. Welcome back. We're still talking to Dr. Ibtisam Al-Badr. Dr. Ibtisam, before the break, we were talking about the courses and the accreditation for these courses. Are there any specific courses tailored for the public?
Exactly. I'm glad you asked me this question. There are important courses for the public, especially from the AHA. They are the what they need to do before the paramedic arrives and to take over. Mostly, they can mean sometimes the difference between life and death, God willing. Examples would be the Heart Saver and CPR course, as well as the first aid course, and of course Stop the Bleed. Stop the Bleed is utilized if there was a car accident or, God forbid, there was an altercation and there was any bleeding on the scene. They can easily learn the ABCs of stopping that bleeding by applying direct pressure and occluding the area that is providing the blood to that organ until the paramedics come and they are taken to the hospital where definitive management will be taken. And I would also like to emphasize a course that is geared towards diabetes care, especially that we are part of diabetes and Dasman Diabetes Institute. And this is the diabetic foot course that is provided by our podiatrist here in Dasman. It's geared towards healthcare workers in terms of nursing, as well as doctors both in the private and in the government hospital.
And wonderful. Now, tell me about the experience and the expertise and the qualifications of the trainers here.
All our trainers are AHA accredited. These are the ones who provide the ACLS and BLS courses, as well as the other AHA courses. Our other trainers who provide the ATLS courses, for example, are all accredited by the American College of Surgeons, and they have the instructor status to teach those courses, as well as the basic surgical course. In terms of the simulation courses, our staff is also trained in those, and they get the period of training before they provide these courses.
All right. So how do people register for these courses?
People register through the Dasman Diabetes Institute site. You click on it, and then you have the Clinical Skills Center. There is actually a booklet that has all our courses. It's very comprehensive. And I'm sure you will put our address and our social media accounts as well from this clinical site.
Wonderful. And in terms of the course itself, does it take place here at the Dasman Diabetes Institute, or is it somewhere else?
All our courses take place at Dasman. There is a possibility of doing some of the AHA courses outside Dasman, but it takes a lot of work. So it depends on the staffing and manpower that we have at the time of the request. We try to accommodate, but if we can, we will go ahead and do that. Otherwise, it's easier to access Dasman. The place is beautiful. Our skills lab, if you have a chance to visit, it will be great. You will see that most of our visitors are happy with the facilities and the training that happens in Dasman. This is what we get from their feedback.
Great. Now, in your opinion, these courses, how do they reflect or contribute to improving the patient care and the basically outcomes?
Okay. In terms of, let's say that you would like to do the ACLS course, which is an advanced cardiac life support course. If you've done the training and the course, when this happens in a hospital, you're able to react because you've been trained to react. You don't have to start thinking, what shall I do first? Let's say if you're doing a basic surgical course in terms of suturing. So instead of people will say, you're talking about suturing, I'm primarily a surgeon. So knots, safe knots are very important in surgery. So to know the basics of that and practice it in a non-human, and then you go and you practice it in real life, then you will get a better outcome for that patient or person you're
caring for. I think, I agree with
Simulation is a big field, and it's always better to learn a skill on a non-human, excel in that skill, and then you practice it on a human being.
That's exactly.
And then even when you practice it on a human being, you are still being supervised. But at least you have the technical skill and know-how before you start practicing on a human being.
Exactly, and you need to maintain and keep that skills going on because, as you know, these are certain procedures that you might not do on a daily basis, for example.
Exactly. That's why all certifications are time limited. Say the ATLS, I think, is 4 years. The ACLS, for example, is 2 years, and then you have to recertify.
And you have to refresh basically your mind. Now, I'm going to be honest with you. There are a lot of training courses and centers out there. What distinguishes your program and your department and your center from other places?
I won't use my words. I will use the feedback we get from our candidates. They are very impressed with the facilities, the location, the trainers that we have for the students or candidates. Some of them are already our colleagues and staff members. We haven't had negative feedback. So hopefully we'll take this feedback and we'll even grow and increase our courses that they would like us to provide for them.
Absolutely. So everybody's happy?
So far as I know. If they're not happy, they can tell me.
Well, we got more questions for you, but we have to take a short break. Stay
Thank you.
Welcome back. We're still talking to Dr. Ibtisam Al-Badr. Dr. Ibtisam, before the break, we were talking about your center and what Ken offers, basically. I want you to share with our viewers some of the success stories that you encountered over the year running this wonderful establishment, basically. Any feedback? You mentioned there is a good feedback. Can you basically draw an honest picture of a real picture of what you saw, the results of proper training?
Okay. In terms of assessment, feedback is vital to find out whether you're doing a good job, whether you need to change anything or change the scenario that you are teaching. One of the, I'll just mention an incident that had happened.
Yes.
I came across that person in a hospital corridor outside Dasman, so it wasn't influenced by Dasman or anything. And I was informed that as a result of a course that they had taken in Dasman, they were able to handle a patient appropriately in real life in the hospital. I can't give any more information.
Yeah.
But this is that made my day, actually.
So it's very rewarding knowing that actually the information and skills that you put actually was utilized when it's needed most.
Yes.
Wow, wonderful. Now, as we mentioned in the introduction, the training, these centers and the people who are providing this training, they need also to be updated.
Yes.
Is there a schedule or a program or like a maintenance to basically make sure that your staff is up to date with the newest protocol?
We are always in contact with the AHA. Once they change their protocols, we get feedback and we put our trainers into the new training for the new protocol that I have used. An example would be the ATLS course, because the edition they are using now is I think number 10. So all our trainers had to certify for that edition before they can come back.
Which is the highest,
the
newest
most
version.
recent.
The most recent.
The most recent version, before they can continue as instructors again.
What about conferences and training abroad, Kuwait? Do you send somebody to basically...
with a limited period, but they would go to, there's the AHA meeting that happens, and we send people to that meeting as well. But in this day and age, you can do your training within the country because you can access them online as well.
Exactly.
So this is why this is ongoing at all times, and we have regular meetings with either the Saudi chapter or the AHA themselves, so without having to get on a plane and travel.
So there is a collaboration between you and other entities?
Definitely.
Within the GCC and also abroad?
Within the GCC, not yet, but internationally, yes.
Because you mentioned this Saudi.
Sorry, within the GCC, our ATLS course, the MENA Center is in Saudi. So yes, there is collaboration.
Okay, yeah, I was going to say, because you mentioned the Saudi, so that's why it's very interesting. So it's good to see that everybody is coming together globally to maintain a high standard, and it's very reassuring that we have that high standard here in Kuwait maintained by DDI. Now, I want to ask you about the future. What do you see the future prospect for our DDI and also for the training center?
We would like to maintain what we have to start with and then add more courses, more emphasis on the diabetes part of Dasman, as we said, in terms of the wound management course, or even simulation courses with parents and children who have diabetes, in terms of giving them scenarios where you see how they will act in a safe setting, so that should this happen outside a simulation, they would be able to act and know what to do. And we would like to also add more courses in terms of the surgical training as well.
Exactly. Do you work with other government sectors, like for example the Ministry of Education? Obviously you work very closely with the Ministry of Health, but I mean, for example, teachers in schools, for example, do you train them?
We do that on a official basis. They actually attend our AHA courses. They're part of the public that we work with. So we have schools coming, banks, some of the food industry,
food and beverage industry,
personnel as well.
Yes, that's fantastic. Now, my last question is, are these courses free, or they have like a certain fees to apply?
There are certain fees attached to the courses.
There's certain fees. It depends on which course.
It depends on which course.
And on a scale, like how many days usually we're talking about? Is it like 1 day course? Is it 2 days course?
We have courses from 1 day to 3 days.
But that not more than that?
Not more than 3 days.
And everyone who attends that course leave with a certificate?
They would leave with a certificate.
And then it's their duty to renew it every like 2 years or what so?
According to the certificate that they received, according to the course that they've taken.
And correct me if I'm wrong, but that certificate is accredited globally, basically?
Globally. Like the AHA is an AHA certificate.
Yeah.
The ATLS comes from the American College of Surgeons.
Yes. The only reason I ask you this because at one time I was myself put in a situation when I was in an airplane, and I have the ACLS course. I am certified to it, and we had a medical emergency during the plane, and unfortunately I was the only healthcare profession on that plane. And it wasn't Kuwait Airways, it was another airline. And when I showed them my certificate, they immediately handed me the whole situation. And I even wrote the report, and then they actually attach my certificate number as well to it. So I guess what I'm trying to say for our viewers, and you can back me up, these courses, these certificates, it's like the common codes or languages that we use globally to make sure that our patients are up to the standard.
And you just made a point on why people should know ACLS?
Yes, absolutely.
This is absolutely amazing.
I mean,
not by people, I mean medical professionals.
Exactly. I mean, I was also impressed that the crew members, they were also trained, they know what to do, but you know, having somebody who is having a higher level of training was also reassuring. And also, it's not just from handling the situation, also when we landed, how we transferred
transfer of care and the information
exactly to the medic first aid, basically. So yeah, thank you so much
Thank
for
you.
all the valuable work that you're doing here, and we wish you all the best.
Thank you very much.
Thank you so much, and we'll
Been a pleasure.
hopefully we will host you again.
Hopefully.
Good luck. Good luck. Thank you so much.
you.
Dear viewers, we'll still have more to show you, but we'll have to take a break. We'll be right back. The Medical Fitness Center in Desmond Medical Institute promotes a healthy lifestyle through the delivery of specifically designed fitness program via personal training, group studio, classes, aqua classes, and open gym. This fitness center serves the role in helping patients with diabetes have a better quality of life and preventing more medical complications. Therefore, it is essential for patients with diabetes to enroll in some physical exercise. But before that, it is important to consult a fitness specialist to provide the best and most suitable exercises for them. Let's watch this report.
What is rounded shoulders? It is nothing but rolling of shoulders more anteriorly than what it has to be. So the patient or the person will be like this. This is not a condition where it causes by itself. It happens because of our adaptation of posture, even at times the muscle imbalance between both groups. So, say for example, if a person is like this, it's not just affect the back, it even affect the neck, shoulders, and even it gives some other conditions like osteoarthritis, even radiating pain. So these are all the conditions which are associated with the rounded shoulders. So what you should do to get rid of this rounded shoulders? You have to strengthen your back muscles and stretch the anterior muscles. These are the two group of muscles which are abnormally acting. So in rounded shoulders, the person will be slouched and shoulders will be more anteriorly located. So now you can notice automatically my neck or my head, it is following my shoulders. It happens automatically. Even if you notice, the shoulder range of motion will be very much limited. Okay, so the moment I stand straight, my neck will follow back and my range of motion is automatically increased in the shoulder. So to make it happen, you have to stretch your pectoralis muscles, okay, and you have to strengthen your back muscles. Because of that only this position happens. In this position, these muscles are more tight and posterior muscles are more weak. How to strengthen your back muscles? You can take a TheraBand. This is easily available outside, and there are many resistance with which indicates different colors, like yellow is the least resistance, green, red, black. Black is the highest resistance. So you can check and you can take according to your resistance level. Hold it straight, then squeeze your back, hold it for 10 count, then come back. When you are squeezing it back, breathe out. The second exercise what you can do is take a towel, hold it back. Now take your hands back, relax. Take it back, hold it, and then relax. Keep your hands in a W position. Squeeze your back first, back muscles should be tight, then slowly take it up, bring them down. While doing this, make sure that your back muscles are always activated.
that's it for our show today. Hope you enjoyed it. Until we see you again, please stay safe and stay healthy.